Okay. Just one moment ha, i-check ko lang yung ano topic natin. The slides. Hello.
Oh, ma'am.
Okay na? Okay na tayo? Wala nang tanong? I just hope it will be understood, everything, lahat. Pag may tanong na lang, i-message na lang ninyo ako para ano, you will be able to, everything will be clarified unto you so that you understand. Now, we will go to urinary catheter and skills asepsis, how to do it. Now, Dr. Frederick Foley, he developed in 1920s by Dr. Frederick Foley. He is the one who make this Foley catheter. The urinary catheter was originally open system with urethral tube draining into an open container. But in 1950s, a closed system was developed, which is in the urine followed through a catheter into a closed bag. So the founder for this Foley catheter is Dr. Frederick Foley. This is a Foley catheter is made of soft, thin rubber tube with a balloon. This is the balloon inside, as you see the picture. At the tip is where located the balloon. Now the catheter is inside. The catheter is inserted through the urethra into the bladder to drain urine out. So that the urine will come out, you have to insert the catheter in the urethra, and then into the bladder, the urine will be released. The urethra is now open where the urine is come out. So this is how it looks like, the Foley catheter. Now, what is urinary catheter? Urinary catheter is any tube placed in the body to drain and collect urine from the bladder. This is how it looks like, the urinary catheter. These are the different types of catheter type. There is a whistle tip, there is a cord tip, there are two-way channel, there is a T-tip, there is a three-way channel. So if they will ask you, bring me a three-way channel. So this is how it looks like. There is a three-way funnel, T-tip like this, because sometimes if you are in the hospital base, they will ask you, you bring like this from the nursing state. Like the nurses told that, can you please bring me a catheter with three-way channel or whistle tip like that. So you at least you are able to familiarize and you're able to know how it looks like. Okay. The structure of Foley catheter, this is how it's it. Now the catheter tip, there is also the it's very how it looks like. This is the catheter, Foley catheter. Now the urinary catheter utilizations, it's about 15 to 25% of patients during hospitalization will have urinary catheter. Why? Because there are so many patients who are stressed and who are like, for example, when you are stressed and even you are sick, you cannot even pee, or you cannot you will have this retention of fluid in your body and you cannot release it. So, and especially also when you are going um, operating room, you have undergone this diagnostic test, they will put you catheter. um, so we put catheter for this for the patient. Many are placed either be in the intensive care or emergency department. Most of the all of the from intensive care unit or emergency department, we are putting urinary catheter, so that because in this intensive care unit, the patient cannot go out of bed and walk. They are just only lying down, and they do everything in bed. So we have to put urinary catheter. And about 40 to 50% of these patients do not have valid indication for urinary catheter placement. So the urinary catheter utilization, this is it. So there are purpose of catheterization. Catheterization is carried out for a number of reasons that can either be temporary or permanent solution to a number of problems. So catheterization, it's either be a temporary or permanent solution for some people who have a problem for urination. The problems include the physical disease and damage. It can be a damage, psychological issue. Ah, hello? I'm Chappy.
Yes, ma'am. Parang
Chappy?
may echo.
Oo nga,
Merong
narinig
echo,
ko.
ma'am.
Oh, ngayon, wala na?
Sige po.
It's okay? You understand me?
Yes,
Okay na
ma'am.
po, ma'am.
Okay. Now, the purpose of catheterization.
Meron.
Meron.
Nag-echo siya.
But I think it's nobody here. Maybe somewhere else. Now we'll
Ano
go
na lang
on.
siguro, pa-mute na lang siguro ng iba.
Okay, pa-mute na lang. It's okay now?
Yes, ma'am.
Okay. The purpose of catheterization is carried out of a number of reasons kung why we have to put catheterization for a patient. This can be a temporary or permanent solution for some problems. The problems include with physical disease, like for example, they really have a problem for physically. They have a damage for the urinary tracts. There is a psychological issue because of too much thinking and psychological effect that they cannot go out, they cannot urinate, they cannot micturate. And there's also a way to help to improve the quality of life for someone who is bedridden. A bedridden person cannot get out from the bed just to pee, but thank God for catheterization that it helps a person to live in a regular life of the patient because we have this catheterization. Good regular catheterization care involves good hygiene. Yeah, because you know, if you are not having this urinate, you are not micturate, you are not passing it, you soon or later you will have a problem and it become more critical. Because if you will not if you are not urinate at least 30 cc of urine per hour, there will be a problem. So it's either you could have this obstruction, or you have this UTI or anything else. It can cause you a big problem. So we need to pee. Don't hold it. Also, when there is a catheterization, it involves good hygiene. And you have to observe it because maybe it will be out of place na yung tube that you have to put in your body. You have to monitor it. The prevention. and the prevention of infection. Because if you will not able to monitor, and if it's not clean, and if it's not being observed all the time, sometimes nag-overflow na yung urine mo, and at the same time, there will be, when you urinate, there are some bacteria or anything, a foreign body in our urine, which is not desirable for our health. So it can cause you infection. So we have to be very careful for that one. Now, the Foley catheter is like this. For a woman, we have to put in the urethra, and this is how it looks. The urine flows down to the catheter. This is the bladder, and then this is one, the Foley catheter. And for the men also, it's always the same, but the thing is that they have with different parts, because for us we have so many openings. For men, there is only one opening for them. So this is the one. Now, in documentation, details regarding catheterization should be recorded all the time. You have to put some notes, especially when the patient has been monitored for fluids and electrolytes. So you have to document it. For further information, please refer for your hospital. For also, there is a policy also for this catheterization and procedure manual for this one also. There are matters to consider for catheterization. The indication for this catheterization is the time and the date of catheterization. You have to take down notes of that, what type of catheter that you use for the patient. Isn't it that I showed you last before the slide that there are different types of catheterization, and then amount of water in a balloon, because when you put the catheterization, you have to introduce water also to the balloon, so that the balloon will lumobo siya, and then so that it will not come out. And what size of the catheter that you have used, and there's also the expiry date of the product. And if there's any problem in insertion, you have also to take down notes for that one. And you have to take down notes, the urine, how it looks like, the color, the volume that is drained. Because this is very important. Through the color and through how it looks like, the density of that and the volume, if it's the color is cloudy, if it's dark brown, or if it is bloody like that, or the volume is only how many cc, and the patient have been for monitoring for the fluids and electrolytes, there will also be a problem. And also we have to very careful for the specimen collection, because if we are not careful for not using a septic technique for taking specimen collection through catheterization, the result for the laboratory test, it will be wrong already because you contaminate it. There is already a presence of a bacteria or any foreign organism in the urine. So we have to be very careful. Now, what you need for catheterization? When you do the catheterization, you have a dressing trolley, you have a catheterization pack, you have sterile gloves, appropriate size of catheter. At least you know if it's a small, medium, or big person that you have to put. There must be a silicone jelly, syringes, sterile water. For the balloon, syringes, and a specimen jar. These are the things that you need for catheterization. Now, the precaution is that you have to wear gloves. And also, if you have what they call mask, it's also possible, because you know sometimes there are some undesirable smell also. So you have to wear gloves as long as possible, because in Philippines it's not that only buying gloves. But if we are here, it's better to have this. You have also this gown, you have this mask, and then you have this gloves. Now, to choose the right catheter, you have to choose the smallest catheter size that will drain adequately for its intended use. Because if it's not if not intended use, it will be not successful. It will be sometimes it will go out also, or it come out from the patient. So you will not able to drain everything from the patient. Catheters range also. There is a size from 5 to 24 FG. For women, the guideline size we have 12 to 14. And then for men, 16 to 18. For suprapubic, because also if it's that the patient is, because there are some recommendation and different recommendation for that one, they require for suprapubic, for so they ask for 16 to 20 FG, or for if the patient is having a hematuria, 20 to 24 FG. Now, the Foley-Cat is hematuria catheter is required for a three-way. Yung three-way catheter should be used to allow for the option of continuous bladder irrigation without requiring a further catheter change. Because, you know, if the patient has a hematuria, really you need to encourage to drink more water, and then you have to empty the bladder from time to time. And when it is not used, irrigating port should be is together. So what we need to do is that if there is a patient who have this hematuria, we need to evacuate micturition. We have to drain it all, because it can form also stone for the patient. That is why there are some stone formation, and also from a foreign microorganism that will come to us. So it's better to drain out all the urine. The length of catheters are available in three lengths. It can be a pediatric for a child. It can be a regular length, and for female length. The female length is shorter length catheter from 20 to 25 centimeter. The shorter length is maybe more convenient for ambulant women with long-term catheter, the shortest one. And the shorter length catheter is not appropriate for all women, particularly those who are bedridden or obese. So the shorter, it's not available, so he need to be for female length. In obese women, the inflate valve of the shorter catheter may cause soreness by rubbing against inside the thigh, and catheter is more likely to pull out in the bladder neck. So it's very difficult to put catheter for obese women because of medyo malaki yung thigh nila, and usually there's no space anymore. So we have to very careful to check and observe for the patient who have this a catheter for obese women. Now, catheterization skills in medicine. The ability to insert the urinary catheter is an essential skill in medicine. Usually, this one who is doing also is for the like the doctors, the interns, like that. And also, for there are some nurses already in Philippines. For us, we are doing it, but I don't know here. Usually here, those who are skilled, they allow it. Catheters are sized in unit called French, where one French is equal to 1/3 of 1 millimeters. Catheter vary from 12, which is small, French, from 48 also, which is FR, to 48 is large. FR is 3 to 16 mm in size. This is for the pediatric. Now, the catheters are available in different varieties. They also come in different varieties, including without bladder balloon. and ones with different size. So this is how it looks like with different size. And you should check how much balloon is made to hold, to inflate the balloon in water. Because if it's not inflated, it will come out uh, the the Foley catheter. So when you put it, it must be balloon, and the water you introduce, it must be inflated. Now, there is another one which is indwelling catheter. In indwelling urinary catheter is the one is left in place in the bladder. Indwelling catheter may be need for only a short time or for a long time. This catheter attached to a drainage bag to collect urine. Now, for the newer type of catheter, it has a valve that can open to allow the urine to flow when it is needed. And indwelling catheter may be inserted into the bladder. Just it look like when 1 minute. This is how it look like. Indwelling catheter. This is how it look like. The potential for contact with a patient bloody or body fluids while starting a catheter is present in an increase with inexperience of operator. Um, gloves must be worn while starting the Foley catheter, and not only to protect the user but also to prevent infection in the patient. So you must always wear a gloves and before you start the Foley catheter. And because usually before you start it, you already hold it the parts of the women. So the trauma protocol also, for all team members, you have to wear gloves, face mask, and eye protection, and you have to wear gloves and gowns yun. So that is the precaution. You have to wear gloves, face mask, eye protection, and gown. Explain to the patient before the catheterization. Before you go there, you have to sterilize your hands, and then you explain for the patient that you will do catheterization. And before you start, tell the person what you are going to do and why you are doing catheterization. It is important for them to know, especially if the person is confused and has a memory problem. Like, for example, Alzheimer's disease or dementia. You have to explain why you do catheterization of the patient. You explain it because they are not evacuate all the urines. So you have to put catheterization. You can assist the catheterized person for their hygiene. You have to instruct them to do a hygiene rather than doing it yourself, because it's not everything you do for the patient. You have to encourage them also to do by themselves. It is important also to try to help person to do by themselves. Now, you have to use also disinfectant. Now, you have to provide an iodine. Currently is the most widely used agent for the site of disinfection, yung iodine solution. It's iodine, no problem. Iodine solution is written here. Betadine. Yeah, it's also betadine. Now, chlorpheniramine, gluconate, or CGH has been compared to PI with mixed result. We have to perform a formal one. So yung mga skills catheterization to be perfected. Now, yes. Any question? Okay, we'll go on. Now, this is the reproductive organ of a woman. Now, in women, we have different opening. There is a labia minora, there is a urinary meatus, there is a labia majora, there is a vaginal orifice, and we have this catheter. So you have to put the catheter in the urinary meatus. So this is how it looks like. Now, for condom catheters, which is common frequently used in elderly men with dementia. There is no tube placed inside the penis. Instead, it's a condom-like device placed over the penis. A tube leads from this device to drain the bag. Ganito siya, para siyang, it's look like a condom. When men suffer with incontinence, these are the things going to do. When a man is unable to control his urine for a long period of time, he's said to be incontinent. So if the person cannot able to hold on urine for a long time, the patient having incontinent. To avoid soiling the cloth or the bed, the linen or the, what do you call this one, the linen of the patient in bed, to avoid this one, clothes and bed or condom style sheet can be used to connect the penis to a closed drainage system in which urine is collected. So this is how it looks like when the patient have a male man have incontinence. So they have to put a condom style sheet so that it will not be wet all his beddings. This is to avoid having a catheter inserted into a man's urinary bladder and greatly decrease the risk of bladder infection. So this is how it looks like. Now, there is also intermittent short-term catheter. Some people only need to use catheter on occasion. There is a short-term or intermittent catheters are removed after a flow of urine that has stopped. For more information, also we have a type of catheter that we can use. You have to clean intermittent self-catheterization. This is it. Now, hand washing is the most important in preparation before you have to do catheterization. And and do not allow an outlet valve to touch anything. Once you have been sterilized, you wash your hand, so you hold already with you all the devices, all the things that you have needed, and do not allow, after that, do not allow an outlet valve to touch anything. If an outlet become obviously dirty, clean with soap and water. There's also a septic hand rinses, many using alcohols. We need to 60 to 70% alcohol solutions and effective against bacteria, virus, or fungi. It is also protective against hand drying, faster increase of compliance. In caring before the insertion of catheter, you have to wash the catheter entry site with soap water twice a day. You have to clean several inches of the catheter too. Always wash the site after the bowel movement, because if you will not able to wash it, some organism, bacteria, virus, fungi may enter and it can cause infection already. So you have to wash it from time to time, especially when the patient will go to the toilet. Now, a healthcare worker should develop skills in introducing catheterization. Introduction of female urethral catheterization, the insertion of catheter through urethra. It can always do like this into a urinary bladder to permit the drainage of urine as a fundamental skills. Usually like this, the principle of placement of catheterization is like this. The urine collection bag should be at a lower level of the patient to prevent to prevent the flow of or para ma-wet, ma-soil yung bed ng patient. It must be always be a lower one. Now, criteria for insertion of continuation of Foley catheter includes when the patient have a retention, he cannot able to pass out urine. And if there is a critical collection for intake and output of patient, they have to monitor it 24 hours or hourly. They are checking it, they put in a log. And also, we have to put a Foley catheter for a person who is comatose because they were not able to help themselves to get out from the bed, even to take care for themselves. So they have to put catheter. Those persons who are paralyzed, they have a catheter. Those who have a neurogenic bladder, which is the continuity of their bowel vacation is not it's not continuously. When the patient will be able to go to operating room like preoperative placement, when there is with incontinence also, and when there is a bladder irrigation. Sometimes if the bladder cannot be able to remove from our bladder, so it will be a problem. Physical trauma, when there is a pain, when in bedpan, there is incontinence, brief incontinence. When the patient is terminally ill or comfort measure, there is a problem for comfort measure. We have to put Foley catheters. Now, care of inserted catheters. When once that usually the catheter, we are not the one who is putting the catheter. Usually, I think is the nurses, it's the resident like that. But the only thing that we have to do is every day we have to wash around the catheter and the perineum with soap and water. Rinse and dry this area very well because it can cause contamination for the patient. You may shower while wearing the catheter because in daily care, like for example, we do the bathing for the patient. When we do the bathing of the patient, we have to be very careful and we have to wash around the catheter, the perineum with soap and water, and we have to dry it also. And in sitting on the tub, however, it's not recommended when the patient have this catheter. Good personal hygiene prevent the accumulation of bacteria. It reduces the risk of infection and prevent odor. So it is very nice. It really prevents odor and infection for a patient when we are really taking care of them. And do not let the patient sit on the tub. The possible complication when the patient having this Foley catheter, they have an inability to catheterize, urethral injury. By inflating balloon before ensuring the correct catheter placement in bladder. So, kadalasan, we have this urethral injury because of trauma by inflating balloon before ensuring the correct catheter. Sometimes we do it, sometimes the one who is inserting a catheter, it's not right one, so he go to another opening again like that. So we have to, it must be a very sure area where you inflate the balloon so that there will be no urethral injury. Also for infection, if the patient is always cleaning their perineum like that, and it cannot also can have also infection, or encourage them also to drink a lot of water so that there will not be more infection. The patient will always be vacate water or urine. Psychological trauma. If the patient had already trauma from inserting of urethral injury, or the patient has been trauma experience, the complication is very hard for the patient. Also hemorrhage. when the patient has an hemorrhage and trauma sustained during the insertion of the balloon inflation. There's also a false passage. So by injury of the urethral wall during the insertion. So if it's not in the urethral, if you insert it in your urethral wall and it's not the right way, it must be a urethral meatus, you have to put the catheter, but it's in a false way, so it can cause an injury also. Urethral stricture following damage of the urethra. For paraphimosis due to the failure of to return foreskin to normal position following by catheter insertion. Like for example, when you put this one for a man, from the normal positioning, it cannot come back anymore. So you have to be very careful in inserting the catheter so that this complication will not able to have it. The patient will not experience it. Another thing is that the complication of catheterization, main complication is tissue trauma and infection. After 48 hours of catheterization, most catheter are colonized with bacteria already because it's more than, it's very long already. So 2 days wearing this catheterization. Of course, there's already a bacteria leading to a possible bacteremia or an other complication. Catheter can also be cause renal inflammation or neurocystolithiasis or pyelonephritis in left or prolonged periods because of this catheterization. If the patient will not able to pass our renal, which is the renal or our kidney having problem already, it will be inflamed and it can even cause stones from in our renal area or kidney. And by using it for a prolonged period with this catheter can cause so many problems or inflammation or any complication for that one. So we have to be very careful for as much as possible. If the patient can able to evacuate and control by themselves, it's better that they will not use catheterization. But if there's any no choice for that one, or they cannot move out, or they cannot stand, or they cannot help by themselves, better they have this catheterization. The most common short-term complication is inability to insert the catheter also. The causation of tissue trauma during the insertion. This is the short term because if you are not a sharpshooter in putting the catheter and you always do trauma in putting the catheter, it can cause trauma and it's very hard for the patient until the patient would have already pain or any readiness from his area. In his body. The alteration of urethral catheterization includes suprapubic catheterization and external condom catheters for